My name is Dr. Christine Guruya, and or Professor Guruya. I'm an assistant professor and consultant emergency physician in the Department of Emergency Medicine at the Yale School of Medicine in Connecticut. And we are so excited to be here with you all today, not only to present this incredible panel, who hopefully many of you do know, but if you don't, we'll be very glad at the end of the webinar that you are here today and will get to know them. And we're also very thrilled because Kenyan Doctors USA, or KEDU, just turned 1 last month. And so to celebrate this moment, we have a very short video for you all just recounting the past year with so many of you, which we'll play for you, and then we'll go ahead with the meat of the session for today. And that's it, folks. So I'm clearly not tech savvy enough to maximize the screen, so you'll have to go and watch it again on a larger screen if you're interested. But either way, we'll be posting. Somebody's not muted. We'll be posting. Let me turn off. Okay, we'll be posting lots of opportunities to continue to be involved with KEDU, including through leadership opportunities. And with that, friends, to the meat of the matter and what you're all eagerly waiting for, I'm gonna go ahead and introduce our amazing panelists. Remember to keep yourself muted and keep introducing yourselves, where you're joining us from in Kenya, what town, and if you're in the US, what state you're joining us from. So, and I'm getting to their profiles. Just remember to keep yourselves muted, and you can start posting questions into the chat. So first up, I have Dr. Jacqueline Kitullu. She is the immediate past president from 2016 to 2020 of the Kenya Medical Association. KMA is the umbrella professional association for doctors in Kenya, and she was the first female to chair the 52-year-old association. She also chaired the Kenya Medical Women's Association between 2008 and 2012. She's the first deputy governor of the Kenya Red Cross Society and sits on several other boards. And I happen to know that because she's also a personal friend. She's on National Hospital Insurance Funds Board, the Kenya Medical Practitioners and Dentists Council, the Kenya Healthcare Federation, which is the healthcare sector Private Sector Alliance, Kenya Consumer Protection Advisory Committee, Safaricom Health Advisory Board, and Tech Care for All Global Advisory Board. She's privileged to have served as a presidential appointee to the National Economic and Social Council, a high-level advisory board body to the government of Kenya. She's a family physician for the last more than 15 years, running a private practice, and she's an MBA in healthcare management alumnus of Strathmore Business School. She believes this has gone a long way in bridging the communication gap between her health background and her current policy in Kenya. She's the recipient of the Distinguished Service Award from KMA, the Jacobs Well Award for Women Living Deliberately in 2017, Annual Best Communicators, Africa's Most Outstanding Female Professional Award, and the Organization of Women International Trade Woman of the Year. Aside from her busy career, she spends quality time with her husband and 2 teenage sons. Dr. Kitullu, thank you for joining us. Next up, I have Dr. Moshonda, who is a general practitioner currently working at Coast General Hospital in Mombasa County. He obtained his Bachelor of Medicine and Surgery from Moi University College of Health Sciences in Eldoret, Kenya. He has attained training in leadership and management in the health sector from the University of Washington in the US. Excuse me. And he has attained, and he's alumni of the Global Labor University at Witwatersrand, Johannesburg in South Africa, with a postgraduate certificate in trade union rights, policy, and practice, fitting for his position today. He's the acting Secretary General of the Kenyan Medical Practitioners, Pharmacists, and Dentists Union, or KMPDU, where he represents doctors at a national level on employment and labor relations in the health sector. He previously served as the Deputy Secretary General, a position he held for the past 4 years. His roles in influencing policy and laws in the labor and health sectors, working towards unifying doctors to solidify their collective bargaining power, and he's also one of the negotiators of the first ever collective bargaining agreement for doctors in the public sector that has tremendously improved terms and conditions of work. His work in KMPDU has been a great source of experience in employment and labor relations in the Kenyan health sector, and it has made him a champion for doctors' welfare and an advocate for quality healthcare with emphasis on the public sector. Thank you so much, Dr. Moshonda, for joining us. Dr. Liz Maina, next, is a medical doctor with an MBA healthcare management degree. As you see, very esteemed guest here. She has over 7 years experience in clinical practice, both in the private and public sector. She currently works as the CEO at the Kenya Medical Association, who's championing welfare of doctors and quality health in Kenya, actively partnering with government and non-government actors to influence health policy formulation and implementation. She has years of experience in Kenya Medical Training College in a senior position, where she trained clinical officers in Kenya. And she's also a DAAD alumni, the German Academic Exchange Program, and Equity Leadership Program alumni previously. We're so glad to also have you here, Liz. KEDU has had the fortune of interacting with Liz over the years. And last but not least, friends, we have Mr. Nicolas Kyoko, who is a level 4 medical student at Moi University in Eldoret, Kenya. He is currently the president of the Medical Students Association of Kenya, a leading medical student fraternity of about 5,500. He also serves in the International Federation of Medical Students Associations, or IFMSA. He's as the general assistant for that organization for Africa. He's a former finance officer for MSAKE and chairperson of the Medical Students Association of Moi University. He is also known for co-founding a medical education company called RepubMed. Nicolas is a young leader who's passionate about servant leadership and has over time amassed vast experience in administrative and managerial work. He is a lover of research and is an enthusiast about acting locally and impacting globally. His values integrate honesty and teamwork. Thank you so much, Nicolas, and KEDU has also had the fortune of doing quite a bit of work with MSAKE over the past year, and we look forward to more. And so with that, folks, I'm going to request all the panelists just to turn up your video. Again, for those in the crowd, please continue introducing yourselves. So all of you, I'm gonna just go down the line, probably in the order I just introduced you to make it easy. I want you all just to give us a little bit on your personal background in terms of what led you to leadership, what led you to your positions here, including other positions, and what motivates you really to continue and engage with leadership in the first place. So Dr. Kitullu, please go ahead.
Thank you very much, Christine, for that very elaborate description, and thank you for welcoming us actually to this program. Very excited that the conversations where we started and you talked about KEDU now actually brings us to a point where we can actually have a conversation with other doctors in KEDU. My journey really into leadership was interesting, not entirely planned, but somewhere along the way, 2006, the Kenyan Medical Women's Association was getting to a point where it had, a revival process really. So had been a very robust organization from 2008, and somewhere along the way, there were, a few challenges. So it had really gone into a quiet mode. So 2006, the doctors in the Kenyan Medical Women's Association said, let's get this back on track. And those of us young doctors who happened to be in the original meetings were plugged into leadership. So no particular plan, but I just found myself as assistant treasurer, the few people who are willing and able. And I think that's where it all starts. A willingness to make a difference and to make a change. So I jumped in, I was assistant treasurer, and the next year we said, okay, now let's establish, 2 years later I said, let's now have clear elections. And I found myself president or chair of the Kenyan Medical Women's Association. And I think what's really, other than, just that I was there at that point in time when there was a need, was also the issue that when you see challenges as in this sector, you are part of the solution. So we tend to sit back and say, okay, we'll look after the patients and all that, but there are other issues around us that only we can be part of the solution. So I jumped in to be part of the solution, and I think a lot of what then I have subsequently done has been about creating networks that can make a difference within the health sector. So that then panning out from the Kenyan Medical Women's Association, I plugged into the Kenya Red Cross Society, which is, I think you all know the Red Cross and Red Crescent societies around the world, and joined their finance committee, again, to just give input as a, in terms of one from the health sector, because there are many programs within it which are from the health sector. And through that one, I moved along the way up to now where I'm first deputy governor. But that was, again, another network which was necessary to build up the sector. So about a few years later, within the Medical Women's Association, I was proposed to sit on the National Economic and Social Council, where we could actually, as presidential appointee, where we, again, the health sector. So the National Economic and Social Council had two pillars, economic and social, but the social pillar where health falls, again, was one pillar which was sort of sidelined. And I think we all realize that, social issues, healthcare seems to be put on the back burner. So again, an opportunity to bring it up to the policy table, because if its issues are not discussed there, then nothing is left for us. 2012, then I got into the Kenya Medical Association. Actually, I was poached from the Medical Women's Association by the KMA team at that point, and I got in as Assistant Secretary Secretary, and on to Vice President, and eventually to President in 2016. And I think in all these areas, it has been a willingness to be part of the change makers. We complain a lot and we lament a lot, but I think whatever position in which we are, we can actually make a difference. So I have found that sitting in all these various areas, there's so much you can actually contribute, whether it's in the policies around human resources, whether it's about quality healthcare, whether it's partnering along with the unions in terms of welfare of the association. All that, you have to be on the table. You can't do it if you're just sitting outside and being a keyboard warrior. So I have jumped into all these areas, and subsequently from KMA have ended up sitting in the National Health Insurance Fund, and now where I presently sit, which is the Kenya Medical Practitioners and Dentists Council, which is the regulator. So again, you come in with the wealth of experience and the networks you've built to make a difference wherever you're sitting. I think that's really been my journey. It's a willingness to serve and a willingness to make a difference. And honestly, we can all make a difference wherever we sit. Maybe that's a summary of part of it. I have not talked about all the other areas, but I think those are the main ones.
I know, I love that. love that willingness, and these people are certainly willing, and it's not easy. I think, like Dr. Kitullu is saying, and I'm not being a keyboard warrior. Okay, so Dr. Mashonda, or just a keyboard warrior. Dr. Mashonda, please go ahead.
Well, thank you. I think leadership is one experience that I didn't see myself really getting into, especially in the profession. I think I'd envisioned myself being just a doctor who'd serve patients and, I mean, just be the typical doctor, not just really take up leadership. By my experiences right from the undergraduate experience and the need to make things better, I think in Kenya, the environment is very challenging, especially when you're practicing, right from you begin your internship and as a doctor. So I think the story is that I managed to mobilize somehow and organize all the doctors during my internship time to basically follow up on issues that were affecting the doctors at that point. And things happened so fast. I think I sit back and sometimes I reflect and I'm like, okay, I didn't see this coming, but yes. So basically after that, I got elected into KMPDU as basically just a National Executive Council member. And then inside, when you are in that position, you start realizing that there's a lot of policy issues. You start realizing that I started realizing that I also actually have quite a lot of input in terms of policy issues and trying to give direction. And before I knew it, I think I became a resourceful person within the organization. And a year later, I was elected the acting deputy secretary general. Then that was in 2015, 16. And then 2016, confirmed as deputy. And at that time, I think it's when we had the biggest ever industrial action in the country. Sad, but our environment is such that without pressure, without, even as you lobby, without adequate pressure, some of the issues will not be resolved. And more specifically, I found myself now drifting, not just from health policy discussion, but also with a very keen interest on what is it about employment and labor and what specific is it. So I think out of that, I got a lot of interest, and I was able to enroll into the Global Labor University program, where I managed to get the training experience and certification in Johannesburg. And that was the opening moment for me. I had to accept myself that indeed I think more on social issues and more on health as a social healer, and that there's a space for us to effect change. And out of that, then I became this person who decided, okay, fine, this is where I am and this is who I am now. So I will make sure that I push through. So I think I have a lot of interest, and I've realized that out of the work we've done, we developed the first ever internship policy for the Ministry of Health as stakeholders, played a very significant role in enforcing or rather enacting some of the legislations we have on health in the country, like the Health Act 2017, in which we really had a lot of input, just trying to see how we would more specifically secure the welfare issues of the doctors and how doctors are going to run. I think in the human resource aspect of it, in which in that act there was a Human Resource Advisory Council that was set up, and it was one that we really worked on to try and see how it would function to make the doctor's life in employment bearable. Bearable in the sense that I think as doctors we work extremely long hours. We rarely have time, apart from the clinical practice, to just look at policy issues and matters that affect us from the external perspective. And so it's been a balance of the two, clinical work and at the same time policy and legislative work. So it's quite an experience. I think this year is one very interesting year for me because I was deputy up until March, and then life is particularly interesting. Sometimes it thrusts you into a position that you really never saw yourself at that time getting into. So COVID happens, and then whoever was my predecessor takes up another position, and bang, there I am, right at the top. And I've taken up roles. I'm glad I've taken up the roles that I've taken up. I think in my own assessment, I've done my best, even before others would say it, because every day that I wake up, I actually just try and do the best that I can. In the COVID response, I think we serve with Dr. Liz in the technical advisory committee of the Kenya COVID Fund, in which we really focused on personal protective equipment for the doctors and other healthcare workers through getting the standards and quality assessments, visiting factories in which PPEs are being manufactured locally, also set up a training and psychosocial support program that has really become handy for the healthcare workers in the country. And then also in the Human Resource Committee of the National COVID-19 Task Force and the Ministry of Health, where we really worked on the human resource protocols and guidelines for the doctors and other healthcare workers in terms of infection, in terms of protection. So it's been quite some work that if I sit back, it's given direction to how doctors and other healthcare workers' welfare during COVID-19 will be handled. Of course, in the space of KEDU, then there's two pillars: championing the rights and welfare of the doctors, and just to ensure that our public healthcare system is up to par. So COVID-19 has presented that opportunity that for those of us who are really keen on how the systems work, you think through and you look at the gaps, you've assessed the gaps, and give recommendations and directions on what really needs to happen to improve the healthcare system. And I'm glad that I've really played that role in to the best of my ability and my knowledge, and it's a continuous process. I think one really interesting thing about leadership is the ability to listen to all various and dissenting voices, differing opinions, and within yourself be able to come up with a collective position, and not just collective position, but collective way of moving forward with everyone and not excluding everyone. I think that has been the biggest lesson this year, and I'm glad that it's something that I've actually gotten an opportunity to talk about. Thank you.
Absolutely. Thank you for that, Dr. Mashanda. And it's obvious that you're a force, a calm force. So I look forward to our next question, which is you started touching on, which is some of the programs and activities your respective organizations are working on, and also for those on the call, both in Kenya and in the diaspora, and ways to become involved and support all the important work you and others are doing. Let's move along. So we have some time. We'll go to Dr. Liz and then to Nick. Guys, continue to start posting your questions as you have them into the chat. We will collect them and answer them at the end. I just want to make sure people don't forget their questions. Dr. Maina, please go ahead.
Thank you very much, Prof, for inviting me to this webinar. I'm Dr. Elizabeth Githu Muigai. I am the CEO of Kenya Medical Association. So regarding my leadership journey, I would say that pretty much you'll say started from enrolling into the equity group as part of the equity leadership program, and that shaped the journey towards leadership, because there was a lot of mentorship happening in the bank even as we went about their duties. Then I went to medical school, and after medical school went back to the foundation regarding setting up the Equity Afya clinics. When I worked in Murang'a, that is the time now I think part of the leadership journey in the health industry started. When you're sent in for internship, you're sort of being given leadership position, because you're called when the patient is sick, you're called when the patient is dying, and the nurses are depending on this 23-year-old who has just finished medical school and has pretty much zero experience, but there you are. You have to be a leader within an institution. So, and having to see the various challenges within the health sector, and the various in terms of infrastructure, in terms of the lack of funding to the healthcare system, that pushed me to want to make a difference. And after my internship, when I moved to the Kenya Medical Training College as a lecturer, I enrolled into my MBA in healthcare management at Strathmore, as I went about teaching within the KMTC. And also within that, also realizing the kind of shortages also we face in our university and teaching institutions, as because the students within the public healthcare system, their learning is dependent on the amount of effort that is being put into making the public healthcare system better. So even as I went through that, straight in internship, maybe to take back in terms of leadership journey, is always being able to take up mentorship. Sometimes we talk about people not mentoring, but also on the other side in terms of receiving mentorship. So while I was doing my internship, I'll mention Dr. Kigondu, who's our Secretary General. He's the one who introduced us to KMA. So he's always asking, where's your 5,000 bob to pay for your membership? After that, he linked us, myself and Dr. Bosire, to Nairobi Division, and it always sit in the council and get to learn. So we sat in the Nairobi Council of Kenya Medical Association. We joined the committees. At that point in time, I served in the Reproductive Health Committee, and after a period of time now, I started serving as a treasurer at Nairobi Division. So that also formed part in terms of the journey within the association. As I worked in the association, at KMA at 50 during the conference, Dr. Jackie's team had thought the young doctors are not represented, or their interests are not represented. At that point, I was appointed to serve the Young Doctors Network as the first as the first chair. It's a new committee. There are no terms of references. There's pretty much nothing, and there you're given something and you have to rise to the occasion. So I think also taking up challenges is part of the way you grow leadership. In terms, if you never take a chance, if you never take a risk, it's you cannot lead anybody. So you always have to take a chance. So having served in the Young Doctors Network, and that is when I came into the leadership of CEO in 2019. And that is due to the interaction I've had within the National Governing Council of KMA. As I served as CEO, I've served in various committees, and I've been given opportunities to serve within government and to serve in other committees within the Kenya Healthcare Federation. And during this year, during the COVID-19, I was invited to serve with Dr. Mochonda in the technical working group of the Kenya COVID Fund, which at the same time is also pro bono work. But when you're called to serve, taking up opportunities when they're offered to you, giving your time when you're offered to. So within this committee, as has been said, we have done a lot in terms of assessing PPEs, assessing the PPE tenders, going to the committees and checking whether the PPEs are good for the workers. Again, within the fund, I also serve as the program manager for the COVID-19 training and psychosocial help that the Kenya COVID Fund and the Equity Group Foundation is taking up in terms of helping healthcare workers. So what we do is that I coordinate weekly webinars in COVID-19 case management. We also do mental health support through webinars, and we also run a call center. So that's what I do in terms of day-to-day life, and it's about taking up opportunities. Remember, even when you are starting this project, pretty much there was no structure. We had to form the structure, and somebody had to take up leadership. So even leadership, when it is not defined, taking up spaces, offering yourself to actually serve, because at that point in time, I think if Dr. Machonda can remember, I don't think there was any appointment. I just said I can do it. So, and everyone was like, okay, if you want it, take it, be the program manager. And that is how pretty much it started. So again, I would say it's been a beautiful experience learning from people like Dr. Jackie, accepting mentorship especially, I think is the one point of leadership that is not taught, ensuring that you're utilizing your networks in terms of the people that you're around, learn from them, be patient, walk around them. It doesn't always pay right now, because I remember even when you are joining the council, you're driving, you're just a simple limo, you're driving all the time at 6 p.m. to go to KMA Center, you're being sent to meetings, and nobody's paying you for these things. So, but recognizing that these are the networks which grow you, and recognizing to take up opportunities, I think that is what I've learned within my leadership journey, and taking up risks. Thank you, Dr. Kristen.
That's excellent, Dr. Nana. So much respect for you, and so much respect for the moms on the call, guys. Can we just take a moment for them? Okay, it's possible to be a mom and maybe a dad. I don't know if some of the gentlemen are fathers, but and still really do it all. And I love that what you said, Liz, about being called to serve and being brave, taking a risk. Nicolas, Mr. Kyoko, please, if you could just round us off with that question.
Thank you, Prof. And thank you for this opportunity to be on the panel alongside some of the leading doctors in Kenya. Indeed, it's a very huge opportunity. And in terms of my leadership journey, it's really mostly undergraduate because I'm still a medical student. And the journeys began back in 2016 when I was appointed the director for special needs in Moi University as part of the University Students Organization of Moi University. And at that particular point, I was in first year, the second semester. It was like a trial and error. I just saw that this was an opportunity that maybe I could try and be the onset of my leadership journey. And in fact, once I got appointed, I remember being called by the dean of students at that particular point, and she was like, "How are you going to manage this position? You're just a first year who has just finished the first semester in university, and you're taking up this role because you have not even seen your performance. You don't know whether you'll be able to balance between studies and leadership." And yes, at that particular point, they believed in me, and I assured them that I'm going to manage my academics well. And I managed to continue the leadership until I retired 1 year later. And that point is where I also decided to try and vie as the vice chairperson of the Medical Students Association of Moi University. Our dean then was Prof. Atuoli, and I was appointed. I was elected actually, and I didn't expect to be elected. Yes, but at that point, then I knew that I have this role that I'm supposed to carry out mandate, and I came to realize that being a doctor does not start when you finish your medical education. It starts right at the undergraduate level, knowing what you can do as a medical student to contribute to the community advancement in terms of healthcare. It's really important, and I don't believe that starts when you become a doctor and you're posted in a hospital to work in. So that is when I realized that there is so much we as medical students can do to impact the community positively. And we established so many projects at that point, engaging students in things like medical camps, engaging students in partnerships, even with the local private hospitals and even the Moi Teaching and Referral Hospital, and we were able to do so much. And the subsequent year, I decided to vie to be the chairperson of that Medical Students Association. And I was elected because of the work that we had done the previous year, and that really marked the beginning of my passion in leadership, because previously I didn't believe that I can manage such roles and alongside my medical studies, because you know what people say, once you get to medical school, it's very tough, and most of the people just continue doing the learning alone without engaging in other activities. And as Dr. Manchonda can tell you that Moi University academics is quite tough. After going through that program, it's quite tough because there are so many expectations, but still, if you have that passion in leadership, you can balance between the two. Then the subsequent year, I was elected as the finance officer of the Medical Students Association of Kenya, that is at the national level, because I had got quite an experience interacting as the chairperson of my local university at the national level, and that trust in terms of being able to balance the finances of the association. I was entrusted with that position, and that is the point that I began working with the Kenya Medical Association, Dr. Liz and Dr. Jacqueline at that point. And even Dr. Manchonda, I remember sending so many letters to them, asking for partnerships. At some point, they were denied, but some of them got accepted. And it was an experience getting to interact at the Kenyan Medical Association and Kenya Medical Practitioners and Dentists Union, because those are things that I thought I would start getting engaged in once I finished medical school. But here it had come. I had got to know leading doctors in Kenya. Yeah, and we after that I vied as the Secretary General or the President for the Medical Students Association of Kenya, and I got the position that is at the beginning of this year in March. And that point is when now I started projects with Kenyan Doctors USA. We have worked for almost 1 year now on various projects within Msake and even with the Kenyan Medical Association. At this point, I also got an exposure into management because you're managing 9 local chapters across the country from 9 medical schools, a population of 5,500 medical students. So you have really to think outside the box. And also at the same time, you are representing all these students at the international level, because our association is part of the International Federation of Medical Student Association. And you are sitting in the plenaries at that international level, and you really have to be an outgoing person to represent the interest of your members. And that gave me a unique experience that I didn't expect that I would learn. So I got to realize that acting locally and impacting globally is very important. And that is why this year we have maximized, even amid the COVID-19 pandemic period, to implement projects that have had an international impact, especially to do with COVID-19, because most of them have been registered with the International Federation of Medical Students Association, and you have been involving these students in our activities. Whenever we have educational webinars, whenever we have activities, we always invite them, and they really like the activities that we do. And even our partner organizations, KEME, KEMPDU, KEDU, I know you also like what we do. And that is really a motivation to take up more leadership and even do more. And I'm excited at this point that I got an opportunity to also serve in the International Federation as the General Assistant for Africa, where I'm able to foster national member organization collaboration across the region. And that is part of acting locally and impacting globally. Thank you.
Thank you so much, Nicolas. We thought it was really important that we brought on trainee leaders, right? So guys, you do not have to be a doctor or professor or whatever else to qualify doctor to be a leader, okay? And so KEDU leadership has been so inspired and so humbled by the amazing work being done by these students. Nick, I think you have a few fans in the chat room already, but we've been so inspired. They're doing such incredible work, and just continue on what you're doing. I'm going to point to our last question because I can't believe the time has flown already, which has to do with, as some of you started touching on, some of the current programs and activities with your organizations that you have ongoing, especially pertaining to COVID-19. And please, like Celestine has asked in the questions, if you can speak on those in the diaspora, what are ways for us to be more engaged, to actually contribute in a meaningful way, ideas and suggestions for that. So why don't we just go down the list again, just so to keep with time. So Dr. Kitullu, if you can open up current programs, activities, how to get involved, and especially for those in the diaspora.
Wow, I think I'll take it with 2 of the organizations. I'll start off with the Kenya Medical Practitioners and Dentists Council. So when we had our first COVID-19 case in March, the Cabinet Secretary for Health designated the council as the National Coordination Center for Quarantine and Isolation Facilities. At that point, I had literally just been gazetted to be a member of the council. So the council is the regulator. It's the one that licenses and registers doctors to practice. And so if Christine, came back home and you needed to practice, you'll have to go through exams through the council anyway, and registering hospitals as well. But at that point, the Cabinet Secretary for Health designated it as the National Command Center for Quarantine and Isolation. And remember, I had just landed there, newly appointed at the end of January. And so there was 1 month, we had sort of had an orientation to the council and were getting ready. And then bang, COVID happened. And our lives were just totally transformed because can you imagine, we've never dealt with a pandemic in that sense. And now we are a command center and we were just sort of setting up things on the fly. Our chair, Dr. Ivan Jenga, really pushed all of us to just get up and do it. There's that point where you always have that fear of what, I've never done this before, what will I do? But there was no time to think. And there we were setting up centers, finding places that this will be a COVID center, coordinating with the National Task Force on COVID-19 in terms of setting up, okay, these are the protocols, how do we put them in place? So a lot of March, April, May, June was taken up in that. And from the council point, again, in terms of leadership, where you're thrown into roles, so Dr. Eva says, okay, Dr. Kitullu, that's your area, run with it. And you're going to, whatever decisions you make, I will back you up. So there again, these opportunities or other situations that arise and you have to just take charge. So, people were calling me from the ministry, from the public, from everywhere, what do I do about this? What do I do? And I'm thinking to myself, I don't even know, but you have to make some decision at that point in time. And there was a point I was doing 200, 300 calls a day. But part of the thing was then setting up structures, setting up a call center so that, the frequently asked questions, we could coordinate them. Then, of course, people started coming in from various countries, as when the airspace was about to be closed. So we had tons of people in quarantine centers and were running through all that. So a lot of that we did and partnered eventually with the ministry and the county governments, and were able to eventually from about May, June, hand it over to the various responsible county departments, and a lot of that work was shed away from us. So at that point, we're thinking, okay, now this is the time now I can breathe and get back to doing what we're supposed to do as a regulator. Then the next point, the Ministry of Health says, no, we need an assessment of COVID preparedness on the ground. And that's what a big part of the work that we've done, and actually presented a very large document with tons of data. Not just on COVID preparedness, but also the health system in terms of preparedness for rolling out of universal health coverage. So in the COVID preparedness, we've been into various teams and classes going around the country, literally assessing what is happening in terms of availability. I'm sure you heard about the need to have 300 beds per county, but it's not just a bed. A bed needs human resource, it needs doctors, it needs nurses, it needs the facilities, it needs equipment, it needs the PPE, all those, in terms of how adequately prepared are we. And a lot of that work we have done within the council. Of course, that's in partnership then, of course, with the ministry, the counties and all, but understanding a large picture. On the UHC preparedness, that has been a wealth of information. We've done 40 facilities per county, literally looking at if we are going to deliver on the president's agenda, Big Four agenda of health for all, how prepared are we? And looking at those granular issues, human resource being the largest issue that came out, inadequate numbers around that in terms of equipment, in terms of even interconnectivity, a lot of the direction we're going into digital health. So a lot of that work, has been from that perspective. The other, of course, I may mention, I do sit on the board of the National Hospital Insurance Fund, and it's an interesting, I'll bring it up because I know there's been queries of why isn't the fund taking up the position of offering and covering for COVID-19, especially because as healthcare workers, many of those in the public sector are covered by NHIF. But then there again, as I said, part of our working in this area is to realize the intricacies and policies that arise, which sometimes obstacles that arise, which you'd think it's a no-brainer. Surely they should cover this. But then as a state corporation, you realize you cannot spend money without an approved budget. So if the Treasury does not allow you, so remember COVID-19 appeared, so of course it's not budgeted for within that year's budget, then you now want to spend money. So much as you'd want to spend it, it's been budgeted to be spent on a whole lot of different things. So then there comes in those little, the dynamics of ensuring that then there's a due process to allow funds to be spent or other funds from government, from the Treasury to come in to spend that. So part of my role then sitting on that is to show the need, why this is a pertinent issue. And that's where our roles come in as doctors, whatever we sit. Let us be the ones to bring clarity to that position. That board has people from all over. I think I'm the only doctor. The others would be from the ministry, representation from the ministry also, which has 2 doctors coming in. But the others are lay persons. So that clarity of why we need to do certain things, that is our leadership role that then one takes up to bring clarity into the situation. And I think if you're following the news, there's some amounts of monies which have been passed. But then, even as you work along that from the inside, then you also have the leadership from the outside also plugging in to bring that the issues to the fore. So in these 2 areas, they are very specific, maybe, and you've said to put in the role of diaspora. Maybe they may not apply directly in these 2 areas, but I'm sure Liz will talk a little more how the diaspora can plug in through the Kenya Medical Association. Thanks.
Perfect. Thank you so much, Dr. Kitullu. Why don't we go to Liz then, just to jump around. Dr. Maina, do you want to go ahead and please, current programs, activities, and how those can get involved, including those in the diaspora, please. Dr. Maina, did we lose her? Oh, did we lose her?
Sorry, Dr. Kristen.
Oh.
I'm here. So in terms of the COVID-19 response that the Kenya Medical Association has done, I think within our association, and again, jumping in from where Jackie had said regarding the fact that the pandemic happened and everyone was sort of unprepared, and we sort of had to jump in. We have volunteered as a Kenya Medical Association within the KMPDC and helping up in terms of the setting up of the quarantine centers. Some of the young doctors came through and were able to volunteer during that process. KMA, through our various participants, have sat within the COVID-19 task force of the Ministry of Health, both in the HRH committee and in the COVID case management committee, among other committees where we sit in terms of assisting the COVID-19 response. We have worked with various partners, including Uraia Trust, where we have done public messaging for COVID-19 in terms of creating messages which were actually done into posters, which went to the public in terms of teaching people how to wash hands, negating the stigma that came with COVID-19, among other things. We have worked with Africa Voices, again, also creating a platform where we have done messaging. Other partners we have worked with include now the Kenya COVID Fund, which is now a majority of the work which we have done this year with the COVID-19. So we do training of healthcare workers in all the county isolation facilities on case management. Number 2, we also do online webinars every Tuesday. We do our mental health webinars every Tuesday, and the case management every Thursday. We run a call center, and the call center is specifically for medics, that is for all the healthcare workers to be able to call in and be able to help in terms of setting up their mental health, among the various challenges that maybe Dr. Machonda will explain within the COVID-19 situation with healthcare workers, among lack of salaries, lack of PPAs, in terms of exhausting working hours, which I think in terms of the call center, people are able to call in and be supported in way. So what ways can partners help? As you realize, most of the association membership are funded. So in terms of use member subscription to be able to run activities, And being a voluntary association, most of the professional associations suffer from that. You're voluntary, so you're dependent on which member is willing and able to pay. So the funding is not usually adequate for you to be able to run programs. So this year we are very grateful that the Kenya COVID Fund and Equity Group Foundation actually believed in us and were able to fund the various activities, which have created a very, very big impact and even created visibility of the association, and also a good feeling among the healthcare workers that we're actually utilizing them to teach their own, utilizing them to help their own. So creating solutions within the health professional associations. And we have done webinars with various other partners within our ecosystem to be able to give either knowledge or skills regarding the COVID-19 pandemic. Among the partners we've worked with this year is TC4A, who graciously recorded part of the Ministry of Health training, COVID-19 training, and we were able to share it with our members. So how can diaspora plug in? I think majority of the times, possibly most association would actually need funding, but way above that, I think in terms of partnership is what are some of the activities that we're able to do together. Key among them is are we able to share technical expertise? Are we able to have projects together which are run between the two countries, where possibly maybe the part, even if it's KEDU which is funded, but most of the activities also run within the professional association. It helps create also some bit of confidence within the association to be able to know that they can actually run projects. So I think the kind of collaborations and the kind of work that can be done is about creating linkages, mentorship. We're able to do research, we're able to run programs, and part of the costs that actually drive our programs is on staff cost. And associations, I think, run on very minimal staff costs, because majority of the board members, majority of the people who serve in the communities actually serve pro bono. So pretty much with such kind of partnership, it will enable activities to be done both globally with a very local touch, and creating even buy-in within the healthcare workers system, because some of the projects that are run possibly that the healthcare workers do not buy into because the associations don't know, they end up being expensive because you don't have the networks. But I think we can leverage on the networks that the associations have to be able to make programs more feasible, more efficient, less costly.
Perfect. Thank you, Dr. Maina. So more on that. We it's been a crazy time for everyone with COVID-19, but more on that also through the KEDU website in the new year. So Dr. Moshonda and Nick, I know we don't have much time, but we're going to go over 5 minutes because we started a bit late. So Dr. Moshonda, please go ahead. Moshonda, you're muted if you're talking.
Yeah, so I'm saying there's a lot of activity happening on my end because doctors are about to go on strike because of several issues. So yeah, I'll be very brief. But what we've been able to do as KMPB1 is through the National Task Force of the Ministry of Health, we participated in, we actually part of the Human Resource for Health Committee that has given direction on HRH protocols and guidelines, the working environment, if you get sick, what happens, the testing, how you move, and making sure that healthcare workers are really safe and not exposed during these times of COVID-19. As an institution, rather as a union, we set up what we call the Caring for Carers Fund, in which we basically asked for partnership, and we are able to secure PPEs for the doctors in various parts of the country, one from M-Pesa Foundation, two from the GlaxoSmithKline pharmaceutical company, and three from different other partners. And we're still getting requests now from partners that are willing to come on board. So we've been able to distribute these PPEs, more specifically level 2 PPEs, to most of our doctors in the country. We've also participated in I think we have the program running in conjoined together with the Kenya Medical Association on the psychosocial support and training for healthcare workers under the Kenya COVID-19 Fund, where we equally on the technical board. I think beyond that, we have several other partnerships. There's one coming up on an advocacy campaign for people's vaccines, so that the global south is able to receive vaccines and get priority for this. Several other initiatives mainly is to try and not just protect the healthcare workers, but engaging government in very other mechanisms and just to put forth. We've also been very loud on advocacy, more specifically on the protection, occupational safety and health of the healthcare workers. And right now we are going to work around an occupational safety health advisory together with the Director of Occupational Safety and Health, just to try and bring COVID-19 situation in the workplace more as an occupational safety health issue, as opposed to just being an issue about PPEs. I think that's one focus that has not really been given priority and focus. So I think that's basically what we're doing. Of course, championing for doctors' welfare. Now, I think the most difficult decision of to engage in industrial action, just to force the government to make sure that the doctors are taken care of in the public health facilities, because the stories around the demise and of our colleagues and the infections are just heartbreaking. That is basically what we've done in summary. And beg if you can allow me to attend to these calls that are coming through.
Yeah, sorry about working at the same time on a late Saturday evening. All the best. Good luck. So I will continue to chat with them, but certainly we could participate with some of the advocacy and both informally and formally, and supporting mental health. I think within our community for sure. Nicolas, do you want to go ahead?
Thank you. I'll be brief. So our term of office begins on 1st of March and ends either 28th or 29th of the following year. So basically that means that our term of office this year has fully fallen within the COVID-19 period. So we began with a lot of challenges because we had to figure out how to continue doing activities amid the pandemic. But we began by establishing a COVID-19 task force with various subcommittees whose focus was on different things. So first, we did a lot of webinars, educational webinars for medical students, because this is a very, it's a new infection that was not known before. And we had to ensure that we conduct a lot of education among them to ensure that in their communities, they can educate their communities on how to take care and how to prevent the spread of the COVID-19. And another thing that we did was a series of social media campaigns through posters, through our various social media platforms, and even the website. And apart from that, we also initiated a research. It's on knowledge, attitudes, and practices of medical students in regards to COVID-19. And I think the results of that paper will be fundamental to understanding how COVID-19 has affected students, especially in terms of practices and in terms of medical education. And other activities that we have initiated this year was starting the first ever journal focused on publishing papers for many healthcare students. And this is not just for healthcare students within the country, but also globally. So this is one of the ways that the diasporans can get involved in our activities. The journal is called the Repub Healthcare Students Journal, of which actually Prof. Christine Garia is part of one of our reviewers. So that is to encourage all the medical students, all the healthcare students to submit their papers for publishing if you have not done so, because it's pro bono. Another thing that we've done is through our various standing committees. Our organization is in such a way that we work through the standing committees on various things. So we have standing committee on sexual and reproductive health, which has done a lot of activities we have mental health, which has been taking care of mental health of medical students and organizing mental health focused webinars in collaboration with other organizations to just ensure that medical students stay safe mentally, and public health research and so on. So we have been working through those committees. And also we have a project that runs focused on reproductive and sexual health for Kenyan teenagers. And currently we are doing a lot of sensitization to students in schools, and even distributing pads in various counties within the country. And that has been really life-changing for those young teenagers who are not able to afford these pads, and some of them are being distributed in such a way that they can use that for 5 years. So I think that is really impactful. And currently we have our ongoing General Assembly for this year, on which we are focusing on universal health coverage and youth. And that is through that we are holding a lot of sessions, a lot of workshops to just train students on how to get involved in universal health coverage. And also mentorship has been very key through this year, because we have been able to engage students in various mentorships from professionals, and also trying to bridge the gap between professionals and students, because that has been something that has been existing for long. So the ways through which those in diaspora can get engaged with us is through getting involved in activities that are always advertised through our official communication channels, and also participating in our webinars when they arise, and even submitting the papers for publication in our journal. And I think those are very key areas that we can even collaborate with other
Nick, we lost you for a moment. I'm not sure what just happened. Let me try turning off his video. We lost you, Nick, for a moment, but left off with some very important programming ideas. Sorry, Nick, we lost you at the end. But right, so you've heard about many of the amazing programs they're doing with Msake. We have several of them actually up on our KEDU website that we have worked with them on over the past year, like Repub. And in fact, we just submitted a grant co-submitted a grant with Msake. KEDU did to get them some funding for that project. So you can also check KEDU's website for some of Msake's programs. And so with that, I know we're about 8 minutes over. I want to respect people's time. We didn't get to all the questions because there was excellent discussion from our leaders. So I've posted our discussion forum where we will post some of the questions that weren't answered, or you all can also post. And we'd like to kindly request our panelists to also direct themselves to the discussion forum today to try to answer some of those questions, or tomorrow. So again, thank you all so much for your time. Thank you for all that you're doing. Our hearts are with you, even as you're serving at the front lines and doing so much work. You really inspired, I think most of the people we have on the call today, many are trainees. So I think you really inspired a lot of people. So thank you. And we hope to continue. We hope to have you again another time.
Thank you, Christine.
Thank you, Prof.
For the invite. It was a pleasure.
Thank you. Take care, everyone. Have a good evening.